Thank you again. In fact, you should have listened to this before Dr. Nagina's talk. Thank you, Dr. Nagina, for setting the stage. So, what is obstetric medicine? It is a unique subspecialty of medicine and obstetrics that deals with pregnant women having medical problems. It could be predating, as Dr. Nagina mentioned, coinciding or following pregnancy. It is, the pregnancy is a special situation, as you know. It distinguishes normal physiological changes and serious underlying pathology. So what are we dealing with in obstetric medicine? Chronic conditions that predate pregnancy, like asthma, diabetes, hypertension, cardiac disease, or new conditions that occur because of pregnancy, like hyperemesis gravidarum, obstetric cholestasis, amniotic fluid embolies, or acute conditions that are unrelated to pregnancy, pneumonia, influenza, hepatitis, HIV, and COVID-19. Well, there is a myth that ideal pregnancy should be medically uncomplicated. Why is obstetric medicine important? Because average maternal age is increasing, because comorbidities are increasing, obesity, hypertension, diabetes, and maternal mortality and morbidity linked to medical disorders. The fact that mortality of maternal death is doubled in the US over the last 25 years. Morbidity, 1 in 10 will suffer from some illness during pregnancy. The obstetric challenges are now more medical. The obstetricians are very good in dealing with the surgical ones because the pregnant ladies now, their maternal age is increasing because of career choices, social reasons, because of better health care, because of improved survival of diseases such as chronic heart disease or sickle cell disease or cystic fibrosis. And the reproductive medicine, as you know, is achieving pregnancy in women no matter how sick or old. The good news is that most maternal deaths can be prevented and most prenatal illnesses are treatable. So obstetric medicine, pregnancy offers a window into the future health status of a woman, unmasking medical risk, acting as a stress test for diabetes, cardiovascular disease, thrombophilia, and genetic predisposition to illness. It is a remarkable opportunity to improve women's lifetime incidence of these diseases, modify risk factors, promote a healthy lifestyle in women and their families. So why obstetric medicine physician is needed? Because there is difficult communication between obstetrics and general medicine specialists. Because medical specialists may not be well versed with pregnancy-related challenges. Multiple consultation for the patient in probably another general facility, and patient ownership. So what is the scope of service? Consultation service, all pregnant women with medical problems in pregnancy, either predating, caused by pregnancy, or coinciding with pregnancy. In 1994, the late Dr. Cecilia John here in this photo asked me when I was in Jazeera Hospital as a general physician to come and join her team. And that where we established the first obstetric medicine unit in Corniche Hospital. So Corniche Hospital, for people who don't know, is one of the largest maternity hospitals in the country with about 6,000 to 8,000 deliveries per year. 10% of patients are referred to the obstetric medicine. We have two full-time obstetric physicians. Now we have a third one, Dr. Fadla Farouk, who is here in the OIT. With Dr. Nagina, we are running the service for some years. 2 combined diabetic clinics for insulin-requiring diabetes or gestational diabetes or non-diabetes type 1 and type 2. This was the team at the beginning of establishing the unit. So in March 1994, that is the start. As I said, it's a standalone maternity hospital in the UAE. Obstetric medicine department was established, daily inpatient and outpatient consultation for women with medical problems, and we had 24/7 on-call service. We established combined clinics in hematology, respirology, and nephrology, cardiology, and neurology. And these clinics were manned by consultant obstetric medicine physician, consultant obstetrician, and supportive staff, and a specialist from either Sheikh Khalifa Medical City, Sheikh Shahood, or Cleveland Clinic. And we went on and established with a high risk of obstetrician like Dr. Salih, and we established these subspecialty clinics and multidisciplinary clinics every week, 1 day in the week, every month. And this is some of our combined clinics. Dr. Wain Mohammed, the cardiologist, Dr. Jazmati, who is a pulmonologist in the Sheikh Shahud, and Dr. Spence, who left his country, was a hematologist. The diabetic clinic was started in 1997, a multidisciplinary approach with obstetrician, obstetric medicine physician, a dietitian, diabetic nurse, and family medicine specialist, and neonatologist, and patients, of course. As you know, the obstetric deals with the obstetric side, with the early pregnancy problems, prenatal testing, chromosomes, prenatal testing, assessment of fetal well-being, timing and route of delivery, management of delivery, management of puerperium, and breastfeeding and constipation, contraception, sorry. And the diabetes physician's role was type 1 and type 2, diabetic control of insulin, pre-diabetes, diabetic ketoacidosis, diabetic nephropathy, assess of control, regarding time of delivery, where we consult ourselves, and investigation of therapeutic changes like oral treatment with metformin or sulfonylureas or insulin pumps. So our achievement in this period, that we had this obstetric medicine general clinic 3 times a week, had the combined clinic and the obstetric medicine subspecialty clinics, and of course preconception counseling and pre-operative assessment. A milestone in our department is that the Royal College in March 2010 recognized the hospital or accredited the hospital as the first unit and only facilities outside the United Kingdom to provide training in maternal obstetric medicine for obstetricians. And these are the people who supported us: Dr. Maggie Plot, who was the Vice President of Education of the Royal College, Professor Hassan Shahata, who was the ambassador for the MENA region, and Professor Cathy Nilsson Piercy, who was an obstetric medicine physician and was the chair of Obstetric Medicine International Society. And for that, I had been recognized with the FRCOG. These are some cases to give you just a flavor of the problems we are facing. For example, one of the cases where a patient was 34-year-old Emirati with pancytopenia, obstetric cholestasis, and preeclampsia, had to undergo cesarean section, and then she had acute lymphoblastic leukemia and had a bone marrow transplant. Another case, CKD, stage 4, hypertension, nephrotic range proteinuria, dialysis from 15 weeks with intrauterine growth restriction, with static growth, had cesarean section at 33 weeks, and the baby discharged from NICU after 1 month. Third case is a bypass aortic valve with stenosis, ascending aortic diameter, and she was on beta blocker, also with intrauterine growth restriction, with static growth, and had cesarean section at 36 weeks, and baby discharged with mother. The last case, sickle cell disease, history of chest syndrome, history of femoral vein thrombosis, sickle cell crisis, and preeclampsia, had blood transfusion, prophylactic anticoagulation, and had cesarean section at 34 weeks. This is just to show the type of cases we face in our daily practice. And to learn more, you have to join the International Society of Obstetric Medicine, or the North American Society of Obstetric Medicine, or the McDonald Obstetric Medicine Society, Australian, New Zealand Obstetric Medicine Society. In conclusion, mortality from obstetric causes are declining, from medical causes not so much. Pregnancy is a risk detector, fitness test for life, warning system, indicates future risk of hypertension, diabetes, thrombosis, and metabolic syndrome. Changing maternity demographics require experts in obstetric medicine. And I have to thank these people who are my teachers or mentor, Professor Michael D. Smith and Professor Catherine Nilsson Piercy, and my team, Dr. Nagina, who is sitting here, Dr. Fadl Farouk, and Dr. Sabina, who left us recently. So big journeys, as you know, begin with small steps, and we hope we will end and see the light at the end of the tunnel. Thank you very much.
Okay, first.